Yes, good evening, everyone. Tonight is our sessions to showcase uniqueness of Malaysian healthcare once again. Okay, tonight we are honored to have Dr. Pavan, who is from Alty Hospital. How are you, Dr. Pavan?
Hi, Vincent. Good evening. I'm very good. How are you, Vincent?
Good. Well, it has been a very hectic 1 week, the last week of April. So tomorrow is
That's great.
Labor Day. Are you working tomorrow again?
No, fortunately, I'm not. I'm considered a laborer just like anyone else or so.
Okay, so for the rest of us, I think tonight is a good time just to understand a bit more about what Malaysia can offer in healthcare. So, Dr. Pavan, I understand that your specialty is more towards what do you call that, orthopedics, is that right?
Okay, well, a little bit background of myself. I am a medical doctor, no doubt. Graduated in with my medical degree, but I decided after some time to pursue the management aspect of medicine. So there are not many doctors like me out there who, instead of seeing patients, we are actually seeing the computers more than we are treating diseases and conditions, medical conditions. So I'm not an orthopedic specialist, but I am more of a healthcare management specialist. I don't know if that is a fair enough description of what I'm doing exactly. So there are many doctors right now that have decided to do this instead of seeing patients.
Okay, so that's a reason why I think your organization has grown so much. So, without any further delay, I'll just put up your slide, and then we're going to introduce who Alty are. Okay, Dr.
Okay.
Pavan, pass to you now.
Great. Thank you so much, Vincent, again. Ni hao ma to all our listeners out there. First and foremost, I'd like to thank you, ladies and gentlemen, to be able to spare your Friday evening to be with us, to be with MM2H, to listen in to what more Malaysia has to offer in terms of healthcare. I also like to take this opportunity to thank the kind people of MM2H, like Vincent, for organizing such a session, because it is important for people who are not from this country to better understand Malaysia, not in terms of only the food like durians and whatnot, but also the healthcare aspect of it. I mean, we should not disregard our health. It's very important for us to know what to do, where to go when the need arises. And of course, now we are sailing in unprecedented times with the COVID pandemic all around us. Things are not seem to be looking any better, but we should not let our guard down. Always practice social distancing and keep your mask on at all times. All right, I'm not going to waste time with further details on COVID and pandemic and the COVID pandemic and everything, because I'm sure we are all quite tired of listening to it out there in the news day in and day out. So my name is Dr. Pavan. I am the Chief Operating Officer of Alty Orthopaedic Hospital. Now, a little bit about Alty. Alty is a hospital which focuses in joint and spine surgery. We are located at the corner of Jalan Ampang and Jalan Tun Razak. It was previously known as HSC Medical Center. There's a new company which is called TE Asia Healthcare, which is based in Singapore primarily, but they are into converting hospitals into boutique hospitals. So these hospitals are not your normal bread and butter hospitals like your Pantais and your Gleneagles and your Columbia Asias, but more specifically, TE Asia Healthcare hospitals are more focused towards subspecialties. A typical example of such a project is the recently acquired CVS at KL Central, which is a heart and cardiac center. It was acquired by TE Healthcare about 3 years ago. So basically, it is the best private center in terms of cardiac diseases, in terms of management of cardiac diseases. So they have also gone into the business of oncology, and they have bought over 50% of Beacon Hospital. And now we have Alty. Alty is wholly owned by TE Asia Healthcare. So the reason that they are doing this is because they want to focus more into the disease aspect of it and ensure there's a holistic treatment in managing the patient. May I have the next slide, please? So as I mentioned, TE Healthcare, they build themselves along four portfolios, four major areas or pillars, if you may say. One is oncology, the other is cardiology, orthopedics, and aesthetics medicine. So these are their four areas which they are focusing in. They've got hospitals all the way from Hong Kong, which I understand most of the listeners are from, and down south to Indonesia. They have hospitals in Vietnam, and right now they have 3 hospitals, well, 2.5 hospitals in Malaysia. CVS is one of it, as you can see on the slide. CVS is a cardiac center. Okay, so they have the best doctors in managing cardiac conditions, right from surgeries and also doing endoplasties and whatnot. As a matter of fact, the doctor that did the surgery on Tun Mahathir is also employed by CVS. He's working there right now. Yeah, that's a fun fact.
In Hong Kong, you have an oncology or 2 oncology center. Is that right?
That is correct. In Hong Kong, we have 2 oncology centers there, and in the whole group of hospitals all over Asia, the only orthopedic hospital so far is Alty, where I am working. It was just launched about a month ago. Until then, no one knew the name. So we just launched it to the group of doctors that are surrounding the hospital, and you will hear more and more of it in the days to come. So as I mentioned, we are focusing more in boutique hospitals and more in subspecialties in management of diseases. So, and our hospitals are not big hospitals, not like all the major hospitals that I mentioned, which has got 200, 300 beds. Our hospitals are usually around 60 beds. Alty specifically is only 44 beds. So we manage, we are little big hospitals. So we are small, but we look into big things that trouble you, big things that interrupt your lifestyle. May I have the next slide, please? Right. So coming back to Alty, some of you might be asking, what does Alty stand for? Why the word Alty? Well, Alty stands for adding life to years. You know, in orthopedics, all the old age people, no doubt they might be old, you know, they are 80 years old, 90 years old, but they do not have the quality of life. Why? Because they have bone problems, they got spine problems, they got joint problems. So no doubt they have years to their life, but they got no life to their years. So it is our responsibility at Alty to add this life to their years. Hence, we came up with the name Alty, which is a short form of adding life to years.
Okay, Dr. Pavan, we have a question from the audience by Mr. Raymond. He's very interested to know about the presence in Hong Kong. Okay, so that's why he's asking you to actually zoom into the map. I think this is the best we can do. In the future, we can try to see whether we can put it bigger. But the name is called Hong Kong Adventist Oncology Center and Hong Kong Integrated Oncology Center. Okay, 香港綜合中老中心同香港港安醫療中心嚇。Okay, this is a Chinese name. Then, but this is just to showcase that they have a wealth of experience in these 4 areas: oncology, cardiology, orthopedic, and aesthetic. But of course, if you are looking for orthopedics, you should look for Alty, right?
That's correct. That's correct. Yeah, there is no any other hospital similar to Alty here in Malaysia at this point of time that only focuses in joint and spine. So like we as I mentioned, joint and spine is our major area of specialty. It is basically the problems that bug people who are older in life, you know, those that are much later part of their life, the older age, matured citizens of Malaysia or any other country. You know, you have joint pains, you have back aches and things like that. So we have the best team of doctors, just like how CVS has got a portfolio of the best cardiac doctors. We have a portfolio of the best spine and joint doctors that are working with us, which I will share with you in a minute. So we are focusing on joint and spine, and we also have a cath lab. So no doubt that we are focusing in orthopedics, but we are not sidelining the other aspects of medicine as well, which is also necessary for good health, which is our heart. Okay, so we do have an established heart center. We have a nice we have a fully equipped cardiac catheterization lab, which has been functioning over the last few years. We have got a lot of patients that came in from Indonesia, overseas in the past, who have come to us for treatment. This is before Alty came into the picture. So we have joint, we have spine, and another area is the cath lab, as I mentioned, for cardiac management, for management of cardiac diseases. And together with that, we also have high technology in imaging services. So there's no point, imaging has in X-rays, MRI, CT scans, ultrasound. There's no point having the right doctors, the right facility, but we also need to have the right technology to ensure that the treatment is seamless and is end-to-end. We want to make sure that the doctors are able to treat you well with the correct diagnosis using the best technology that the science world has to offer to you, which I will share with you in a few minutes. Can I have the next slide, please? So as I mentioned, Alty spine. Now, spine is your backbone, which extends from the back of your head to right to the end of the buttock area. Okay, so all this later on in your life, there's always an issue affecting our back. We'll have back aches, then we'll get the pain radiating down to the buttock and to your legs, and that can be really, really irritating. And some of us might even experience numbness. So that's usually because of the backbone pressing on the nerves. So that is one area that we look into. The next slide, please. And joints. I mean, needless to say, most of us, as we get older, as we put on some weight later part in our life, because of wear and tear, as we get older, our cartilage on our joints as well starts wearing off. When we are born with a very nice, smooth, thick cartilage. Over the years, it becomes more and more, it'll become more and more rough, and it'll become thinner. And then that's when you start having pains on each other because of gravity and your weight. So sometimes any subtle symptoms and signs of nerves getting pinched or not getting pinched when they're lying down can be seen when they are standing 90 degrees, just like this in the weight-bearing MRI. So that's why it's very important to have this kind of simulated MRI. Okay. Another good thing about this MRI is that it is open. If you notice, it is not all around. It's not like a donut that you commonly come across in a private hospital or in a government hospital. This is open. So people do not get afraid, because the usual MRI will take you about 45 minutes. So imagine lying down in your room, in a room alone, surrounded by this donut, and it's making all kinds of noise and everything, you know. And a lot of people get this condition called claustrophobia, where they are unable to tolerate a closed area. So this MRI works well for people with claustrophobia as well. So we kill two birds with one stone in this regard. And I'm happy to say this is the first weight-bearing MRI in the country. Like I mentioned, we need to have the right technology to be able to treat all your orthopedic problems. Next slide, please. Eos System. Now, this is another system that we are very, very proud to own. This is a 3D X-ray system. There is none at all in the whole of Southeast Asia. This is the first technology in Southeast Asia. You can Google it, Eos X-Ray System. So it's exactly like what you see is two rays coming in perpendicularly, and it can take your X-ray right in one shot, right from your head to your toe. Okay, in one single shot, and everything can be seen in a 3D fashion. Okay, and the other good thing about this X-ray, it has also a very low radiation dose, unlike the normal X-rays. So it is good for children who's got backbone problem. There's this condition called scoliosis, where the backbone is bent due to from delivery, from birth, basically. It's congenital. So that we need to monitor how the backbone grows, whether the curvature gets worse. So because of that, the child has to go for repeated X-rays. And of course, repeated X-rays are not good either. You know, you're exposing the child to radiation. They can get all kinds of problems later on, even leukemia, because of excessive radiation. But I'm happy to say Eos system has got 1/3 of the normal X-ray radiation, hence making it much, much safer for children with scoliosis who require repeated X-rays. Next slide, please. So Alty previously was known as the HSC Medical Center. Okay, some of you might have come across it. As I mentioned, it's on the junction of Jalan Ampang and Jalan Tun Razak. Okay, it is still HSC. We are still maintaining the name HSC. Why? Because the name HSC also has got some brand loyalty. Okay, it's been open for the last 6 or 7 years, and we have patients who are actually from overseas who have been coming a lot to HSC for their health screening, for their cardiac treatment, and a lot of other management, all other treatment as well. So we are going to continue with the name HSC. So don't get confused between Alty and HSC. Basically, we are the same hospital in the same building, but we have two different entities. Alty is managing the orthopedic chapter, whereas HSC is looking into health screening as well as cardiac health. Okay, so our health screening as well, we provide checkups through our cardiologists and the 3 medical officers that we have on board. And our health screening packages, which I will share at the end of the slide, at the end of the presentation, I would have to say is definitely among the cheapest in the Klang Valley. Next slide, please. So yeah, let me quickly introduce to you our doctors. We have a total of 8 specialists who have come on board. Well, they have announced to us they've come on board, they have signed the documents, whatever agreements and whatnot. But because of some of them are still working in their respective hospitals, they have not come on board physically because they are completing their what's that word called? Basically, their time to finish with their agreement and their contract at that particular hospital. So, who I can announce are those that are on board right now with us. May I have the next slide, please? Okay, this is Dr. Badrul Shah Badarudin. Okay, he's got a long list of qualifications behind him. He's basically a joint specialist, right? He works at another hospital previously, but now he is on board with us right now. And he has, as a matter of fact, recently conducted our first surgery in the orthopedic, in our operation theater at Alty, which was an ACL repair. Okay, may I have the next slide, please? Dr. Lim Ziwi, he is a spine specialist. So he is also very established in Malaysia. A lot of people know him, and people from all over Malaysia come to him for treatment. So he has joined us as well. His area of specialty is basically endoscopic assisted T-lift. So that T-lift is basically a thoracolumbar fusion where they fuse the backbone, but it's endoscopic. So it use keyhole surgery. You do not need to go through your regular surgery where it involves a big scar and everything. So he does his surgeries just through keyholes. Next slide. Dr. Siva, he is the guru of spine from Ipoh. I mean, everyone knows I'm from Ipoh originally, a small little city up north. And even when I was growing up, I kept hearing this name, Dr. Siva. He's a very, very experienced surgeon. He's built an empire basically in North Malaysia. Everyone in North Malaysia who's got spine problem eventually will end up with Dr. Siva in one of the hospitals in Ipoh. So he is also very much involved in scoliosis surgery, as what I mentioned about children who are born congenitally because of a curved spine. So he does a lot of that. And he also does a lot of minimally invasive spine surgery. Next. We have also Dr. Suresh Sivanandan. He's probably among the youngest in the group. And he has just came back from US. He did a fellowship at Stanford University in California in USA. He has been going back and forth between Malaysia and Singapore because he does do some practice in Singapore as well. Next slide. So the other doctors, so those are the only orthopedic doctors. I'm so sorry, I can only announce those doctors for now because the other doctors, I promised them, I cannot announce yet because they are still completing their job and their career at the respective private hospitals. But be rest assured, they have got an equally impressive CV. They are all basically the rock stars of the orthopedic world. Okay, so in terms of our other services at HSC Medical Center, as I mentioned, we also have cardiac services, which is headed by Dr. Lee Li Ching, very, very experienced cardiologist, graduated from Australia as well as USA. We also have our radiologist, Dr. Noliza Tendot bin Abu Bakar, been with us for the last 3 years. She's very much into being able to read all these latest technologies, MRI, weight-bearing MRI, and EOS system, and she has gone for special training for that because you just need to go, even for reading those kind of X-rays, you need to go for special training. You just can't get any radiologist out there to be able to read those kind of special MRIs and EOS systems. Next, please. Okay, these are the other list of doctors who are also, they also run clinics with us. So the reason I'm sharing this with you is just to let you know that no doubt we are an orthopedic specialized hospital, but we do have support of other doctors as well on board. We have 2 general surgeons, we have a urologist as well, Dr. Datesh, we have an ENT, Dr. Ellen, we have an interventional cardiologist, interventional cardiologist, Dr. Sri. We also have a dermatologist, Dr. Mira with us, and colorectal surgeon, Dr. Paul. Next slide, please.
Doctor, we have a few comments here. Just want to bring it up. Of course, it's from Miss Katiga that can't wait to try your service. But there's a question here. Is there a membership discount for Alty services in the future?
Indeed, there will be. We are at very early days at this point of time, but we will generally, on Sabrina Nordin, our prices, as you will see, if you come to us for orthopedic example, I won't go far, just for orthopedic treatment, whenever we look at our prices, we always compare to our neighboring hospitals, and we tell ourselves that we are going to go at least 10 to 15% lesser for the same treatment that you'll get in those hospitals. So it will be 10 to 15% cheaper than the other hospitals which are just walking distance from Alty. Okay, but we're going to have better specialists with better technology managing the same type of condition, which you'll end up paying more if you go to the other hospitals. So if you ask me about discount membership, at this point of time, we are still working on it, but be rest assured, the moment you walk into the hospital, you want to ask for a specific price, I'll tell you that the price will be lower, 10 to 15% than our neighboring hospitals. I hope that answers your question, Puan.
Yes, okay. Yeah. I think it does. So we can carry on now. Huh?
Yeah, so in terms of medical officers, we also have 3 medical officers on board, Dr. Chandan, Dr. Dalila, and Dr. Lau. They are all very well trained in advanced cardiac and life support as well. And in time to come, in about 2 to 3 months' time, we'll have our own accident and emergency department at the ground floor of the Alty Hospital, which will be run basically by these 3 medical officers who have been with us for the last 3 to 4 years right now. Next slide, please. Right, so I'm very excited to show you what my new hospital is going to look like. So this is after the ID is done. This is what I just want to share with you, the pictures of what it's going to look like. Right now, if you come into the hospital, you know, of course, you will still get all the treatment from the doctors, from the cardiologists, from the orthopedic specialists, but there are certain areas of the hospital which is undergoing renovation. The reason is so that we can serve you better in time to come. So once it's ready, these are a few of the slides which I'm going to share with you on what the hospital is going to look like. So generally, this is a corridor that takes you from the lift, from the elevator to the clinics. This is specifically for the joint clinics. Next, please. This is the nursing, basically the registration counter for the joint clinic. So the joint clinic is going to be located at level 8. And the spine clinic is going to be located at level 5. So we have separated both the group of doctors to different floors. And in between that, we have the operation theaters.
All right, there's another question. Has Alty been launched physically? Can they walk in for services now?
Absolutely. Yes, you can. You can walk in for services, but we are not 24 hours yet.
Okay. There's a question about the locations. So this happened, I have the location map just stated here. Can everyone see this? Okay, you can actually pinpoint HSC Medical Center, which is currently the HSC Health Screening inside Alty Hospital. And it's only about, this is Twin Tower here. Okay, Twin Tower. And then it's only about 1 kilometer away. So technically, for Hong Kong residents, you can always walk to HSN, walk to Alty Hospital within 15 minutes. Okay, so that's how it works.
Okay, so I mean, not only the Petronas Twin Towers, Vincent, it is also about 200 meters walk from the Ampang LRT station. So to get out the Ampang LRT station, you just have to cross Jalan Tun Razak, carefully, of course, and it's just about 100 meters away after you cross. That's Alty right there. Yeah, Ampang Park LRT station right there.
That's right. So it's only about slightly over about 300 meters away from that.
300 meters.
Okay, so it's even closer.
Okay. Yes. So it is very centrally located. You know, it's in the basically in the heart of KL.
Okay.
Right.
There is another question, so I think we carry on first because this question seems to be a very long one.
Okay. Right. So this is what the nurses' counter is going to look like in time to come. This is basically the counter which is going to be located around the ward. So all the doors that you look around that you see around the nurses' counter are the doors to the wards. So most of our wards are going to be single-bedded wards. Okay, so you will have your privacy, and I mean, generally, based from my experience working in other private hospitals as well, a lot of patients that come into private hospital, they want the privacy, they want their own space, they want their own private room. They don't want to share it with other people. So I'm happy to say that at least 90% of our rooms are single beds. Next. This is what the VVIP ward is going to look like, okay, with a beautiful view of the Twin Towers. Hopefully, if the apartments do not come up in time next to our building, but otherwise, be rest assured, you got ceiling to floor windows, full volume, double volume windows with curtains, and if you can see, the colors of the rooms are very earthy, very mild with earth tones, so it's a bit more relaxing to our patients. Next, please. Okay, this is another view. This is the family lounge of the VVIP ward. So of course, the VVIP ward will have the patient's area. Then they'll also have a lounge for the family members to sit, and they'll also have a small little kitchen. Next. So yes, you can see the kitchen in the corner left-hand in the corner of the picture on the left-hand side. So and you got a dining table, sort of like a bar island on the side. Next. Okay, this is a single bedded room. So this is your basic room, mind you. Okay, what you saw just now is a so-called VIP, executive, deluxe, premier, whatever you want to call it. But this is your basic one-bedded room in the hospital. Okay, which I'm sure that you can see that we have looked into details to ensure patients' comfort. Next. Okay, this is also a relatives lounge within the one-bedded room, because there is some of the rooms that are going to have also a relatives sitting area as well. Next. Okay, this is the admission counter for the deluxe floor. Level 8 is going to be our premier floor, where all the premier wards are going to be located. So this is their dedicated VIP admission counter, which we're going to build. Next. Mind you, all of this development, all of this renovation is ongoing. The doctors are on board, facilities are there, but exactly not the way you see it right now. If you want to see exactly what I'm showing you right now, it's going to take us another 2 more months. Of course, it's still work in progress. But in terms of the doctors, yes, they are already all on board. Those 4 doctors that I shared with you. Okay, so this is the waiting lounge. So once a patient is discharged, while waiting for the paperwork to be completed, or even while the patient has to wait before the room is ready, we have created a lounge for them to relax, which will have a cafe and some pastries for you to eat, or for the patients to eat while waiting. Next. Okay, this is another view of the waiting lounge for the patients. Next. Okay, this is a refreshment area or the cafe, which is connected to the lounge area as well. So there will be a separated area as well, where you will get people who are running the cafe, the workers who are running the cafe, who will manage your dietary requirements. So even this on the right hand side, you can see basically double volume windows. You know, the ceilings are very high, so it gives you like an airy kind of atmosphere and environment to make it a more comfortable kind of experience. Next. Okay, this is a doctor's lounge. Nothing much to share here. Okay, next. Okay, the lift lobby. As you come down to the ground floor right now, renovations are ongoing, but yes, this is the lift lobby. But this is how it's going to look like in a couple of months' time. But right now, we have lifts. We have some basic decorations which are already in place. But this is a lift that will take you to level 5, which is where our clinical services are located. So it is not on the ground floor. It is at level 5. Next. Right. So if you don't mind, I would like to quickly share with you some basic prices on our packages. Okay. The favorite among everyone is the HSC Platinum. Okay, that is at a cost of 1,500. Now, what I want to stress here is I have worked in many other hospitals before this. You know, I think it's normal in whichever country you are at. if you go in there as a foreigner, there's going to be an increase of a fee. Okay, there's a basic increase of fee just because you're a foreigner, but not in HSC. I assure you, whatever price that you see on your screen right now is the same price that you would get even if you're a Malaysian. Okay, so there is no discrepancy in prices. Okay, it's all the same. So the 1500 platinum screen includes consultation by a cardiologist. When I'm talking about, when you see their full lab profile, I'm talking about maybe about 100 over blood tests as well as urine tests. Okay, we also do a chest X-ray. We do a lung function test, very important during this COVID season right now, to see how healthy your lung is. So we include that as well in the package. We will also do a stress test, okay, which checks your heart health. Okay, you do a stress test which is managed by the cardiologist. Okay, you'll also do an ultrasound of the abdomen and pelvis. Okay, to look for any abnormal growths or tumors. Okay, and we also do tumor markers. And these tumor markers are the basic tumor markers like your alpha fetoprotein, which is for cancer of the liver, and as well as breast cancer. Okay, and in time to come, we are also going to create more packages for nasopharyngeal carcinoma because we see it a lot among the Chinese community. Higher chance of them getting nasopharyngeal carcinoma, just like Indians get more of colorectal cancer. Chinese community tend to get more nasopharyngeal carcinoma. So we're going to create packages that are going to sort of focus around these particular areas of concern. Next. Okay, happy to also say if you hold a CIMB credit debit cards, you can walk in there, and if you use your debit card or credit card to pay, you'll immediately get a 30% off. So this is an exclusive offer for now for all the three packages that I mentioned just now, Prime, Plus, as well as Platinum. Next. Okay, these are among the other packages that I'd like to share with you. CT coronary angio and the coronary angiogram itself. Okay, these prices might look big to you, but I myself as a doctor previously did a CT coronary angiogram at another hospital in Klang Valley, and I knew the cardiologist and I had to pay 2,500. So this is without you knowing anyone. You walk into the hospital, you sign up for this package, that's how much you pay, 2,000 for the CT coronary angiogram, which by the way is about 95% accurate to be able to pick up any blockages in your heart. Okay, and if you want it to be even closer to 100%, you can do the coronary angiogram, which is at 4,800. Next. Okay, we have also come up with the first erectile dysfunction package, which I can tell you right now is the first in the country. Okay, it's at 10,999, but basically it includes everything. Okay, includes all the, I believe it's 12 treatments that you have to come in for, includes all the consultations, includes all your blood tests, includes all the necessary medication. There's no hidden agenda here. We're not hiding anything. You know, a lot of places you go later on, they keep on adding things to it and the bill becomes very big. And for this particular package, 10,999, if you would separate it individually, the other hospitals out there are giving it for at least 16,000. So ours is at much cheaper price. Okay, next. Okay, as I mentioned, we should not also disregard the health of our abdomen, our stomach, our intestines. So we also have scope packages at 1,250 for upper scope, lower scope 1,950, and if you want to compare it together, it's 2,800, done by our very experienced surgeons and Dr. Paul, who's a colorectal surgeon. Next. Sorry, Vincent, if I'm taking too much of time. Okay, we're done. Just in time. Thank you so much for your time, ladies and gentlemen. I hope you found that interesting and informative.
Okay, I have a few questions for you. The first one will be this. Rebecca has her mom in a wheelchair for a number of years since an unfortunate fall that she had. She had been in bedridden state since, and multiple hospital visits has not improved her conditions. Do you think there's still some hope for her to improve her mobility with all these new technology that you have shared? Dr. Pavan, what is your take on this?
Okay, as I mentioned, technology is important, no doubt. But other than that, it is also necessary for us to know exactly what is the diagnosis of your mother. Only then we'll be able to come up with a conclusion whether will she be treated, are we able to treat her well until she's able to walk again. So we really need to boil down and really to drill down to exactly what her problem is. She could be bedridden because of many other reasons as well. It might not even be a bone problem. Could be some other reasons. Could be a metabolic problem, which can also cause her to be really weak and tired all the time until she's bedridden. So my best advice to you is if you can bring her in, okay, you can make an appointment to see our doctors that I mentioned just now, any one of the doctors, and we can take it from there.
Okay. The next question is, what is the current SOP to send elderly parents in?
Well, the SOP is as long as you put your mask on, okay, you scan your MySejahtera when you come in, all right, you use the hand sanitizer, which we're going to which is located within the lift as well when you come in. That's about it. We don't have, we're not going to discriminate elderly patients or young patients. If you are not well, you come in for treatment, full stop.
Okay. Another question about insurance.
The favorite question. Yeah. Okay. Now that is a challenge right now because of the COVID situation. A lot of the insurance companies are working from home, and we are in the process of getting insurance coverage. But if you're talking about managed care organizations like PM Care, few other like Health Metrics, Health Connect, yes, we are full panels of those TPAs. But insurance companies, the only panel that we have is Etika Takaful for now, which covers both outpatient and inpatients. Be rest assured, in due time, give me another couple of months, we'll work on it and we'll get all the insurance on board as well.
Okay. All right. I think he's amazed by the comprehensive packages that you have on the screening side. But do you offer customized package as well?
Of course we do. Of course we do. Customized as in, if you come in there, you tell us what concerns you the most, and we'll create a package specially for you.
Okay. So just get in touch, and one way to get in touch is, of course, just look for this address. Let me just share the screen here. Okay. And I'm sure you can see there's some numbers to call at the bottom. Okay, this is the number. There's an address. Or you can go to the website. Okay.
That's right.
But in any case, just type Alty Orthopaedic Hospital. I'm sure you're able to get them. Or if you really need some help, contact this team in Hong Kong or Taiwan or in Malaysia. We can put you through to them as well. Okay, so these are the few ways that you can get in touch with Alty.
That's right.
Okay. Yeah. And okay, Peter, thank you for coming. I'm sure that I hope that this will be of help with you. Then for you, and then thank you, Raymond, for participating as well. Sabrina, and then yeah, actually Sabrina actually mentioned that your ID was very well done.
Thanks, Sabrina.
It's very. I don't think it feels like it's a hospital. Wow, it feels like it's a 5-star hotel.
Thank you. We want to make you feel like that whenever you come there. Of course, we don't want you to be sick and come to a hospital. None of us want that. But if by any chance you are unwell, you come to a hospital, of course you want to have a good experience, right? So that's what we are there for.
Okay. So, all right. So that's all for tonight. Thank you, Dr. Pavan, for such an interesting insights about your latest orthopedic healthcare services. Then, before we end, we're going to share a video that's one of these international schools that we're working with. It's called Alice Smith. I believe that it's also as established as Alty Orthopaedic Hospitals in its own industry. So if there are any students coming from Alice Smith Hospital, I'm sure you're going to give them a very good treatment as well, right? Very good package overall. Okay.
Anyway, thank you very much, Vincent, for having us on board. In terms of on the behalf of Alty, we'd like to thank you, MM2H, for having us as well. And to all the ladies and gentlemen out there, thank you for spending your Friday evening with us. And to all our Muslim brothers and sisters, Selamat Ramadan, and hope you have a good Aidil Fitri. even though you don't get to balik kampung, okay lah. The most important thing right now is to stay safe.
Yes. All right. Thank you to the audience as well. Thank you, Natalie, for joining us. Okay. For the time being, we'll see you next week again. See you.
Sure.
Enjoy your holiday. Enjoy your weekend. Okay,
Bye-bye.
Bye-bye, everyone.
Our mission's really important to
Tonight, of course, our partner institution, which is Alty Smith International School. She's the Director of Sales and Marketing of Alty Smith.
This is actually, I'll start with our mission and our vision. And our mission's really important to us, and that's about providing an outstanding British education for a successful international future. Talk about why I chose to come and work at Alty Smith, why I feel families should bring their children to Alty Smith, and certainly one of the reasons why I picked it as a school for my children as well. So the first thing is we are the oldest British international school in Malaysia, and this year we're actually celebrating 75 years. Picture of our primary campus. So as I said, this is still in the middle of KL. And one of the things I always love is actually if you stand in the middle of the playground when you come and see our primary school, you can look up and not see any of the high-rise buildings that so kind of permeate the skyline these days in KL. And actually, it's kind of like a little green oasis in the centre of the city. So this is our primary campus, and this is actually the dining hall area where our students eat every day. And then, as I say, outside of the city, we have our secondary school. This is a shot from the back of the secondary school here, some of our sports facilities, but it's a 25-acre site that enables us to have all the modern facilities that secondary school age children. So this is children from 11 through GCSE and A-level to 18. And actually this shot here is part of our athletics track. We have one of the few ILAF certified athletic facilities, which in the normal time we host quite a lot of track meets. What you can't see is our climbing wall. I'm just going to try and point it out, kind of down here is actually a climbing wall, and this block here is our sports facilities, and it houses 3 indoor sports halls and 3 fully equipped gyms. And just out of sight here is our Olympic swimming pool. So we have an Olympic-sized swimming pool that's in fact just over that, because not only do they swim in it, they also kayak, which my oldest son is always very keen to point out to me. And this is the steps into our library centre. So the second reason that I really think is really important about our school is that we are a not-for-profit school. So we are a single standalone school of the 2 campuses in KL. We are not owned by private equity, or we don't have shareholders we have to pay out dividends to. All the money that comes into the school goes into making the school better and the facilities for the students. So if you join, if your family joins Alty Smith and your child becomes a student with us, you automatically join the Alty Smith School Association. The third reason that we pinpointed here is about our teachers. Our teachers on average stay with us between 5 and 6 years, which is quite a long time for an international school. Most of our teachers are contracted for 2 years at a time. It's a fairly standard arrangement in international schools. So we find our teachers are very happy, they renew, and then they renew again. And the majority of our teachers are British. We teach Bahasa Malaysia, we teach Mandarin, we teach French, and we teach Spanish. So those teachers are usually native speakers of those languages. And then we have a few Americans and a few Australians on staff as well. So in the next reason really is around that British curriculum. So yes, we offer an adapted British curriculum. So in our earliest years, that's very much a play-based curriculum for our children up until the end of year 2, and a very highly personalised learning experience. So our teachers know the children very well, and they are able to guide their learning, focusing on their own interests. As they move through school, that becomes more of a cross-curricular project focus in our years from 3 to 6. So that's still at the primary school, and that's children aged from 7 to 11. And then in the secondary school, they begin to study for their GCSEs and their A-levels. And we are a British international school, and we only offer GCSEs and A-levels. We don't offer international baccalaureate, which I do get asked quite a lot. So I'll just say that one straight away. The learning and teaching is really kind of focused on providing that British holistic experience. So we're encouraging the children to be involved in a lot of activities. And we've won an award for it. So we were very fortunate. This is an international school award. And number 5, we offer, say, a truly international experience. I picked this image here because it's an image of a drama workshop, but I thought it just really shows how diverse our classrooms really are. And I can put up photographs of pretty much all our classes, and they will all show this level of diversity. Across the school, we have over 40 nations in the school, so a really international student experience. And then the final reason is that we do have a vast range of professional partnerships and accreditation. And the reason to include this is that pushes us to keep getting better, to share our best practice with other schools around the region, to strive to keep getting better, but also to give our students a lot of opportunities. The more of these partnerships that we're engaged in, the more we're able to expand the opportunities for our students. In a normal year, our students would be coming and going a lot in terms of having events with, particularly with Fobisia, the British International Schools in Asia organisation, or CSAC, where they would be participating in a whole range of inter-school sports events, inter-school drama and music and maths, coding, and kind of everything that you can think of. And our students are often going all around the region, participating in lots of activities. So they're the kind of 6 reasons that I pinpointed that make our school really stand out. I mentioned we're non-selective. People will always want to know what our results are. When you consider we're a non-selective school, that makes these results even more impressive. So 62% of our level results last year were A star to A grade, which is amazing. We're not taking just the super bright children. Our children all do very, very well. And of the A-level cohorts, 95% of students got into their first choice. Of last year's cohort, we had 4 go to Cambridge. We have 1 student going to Oxford this year from last year's cohort. She's just received her offer. But we also have children going into the Ivy League in the US. So we have one of our students is going to Yale this year. I will at this point just talk about scholarships because it's a question I do get asked a lot. We only offer 2 sets of scholarships, and they are right at the top of the school. So we offer a 50% discount on tuition fees, IGCSE level or A-level studies. Now, as I said, we are non-selective, but we will assess all our students coming in. And the reason for that is to make sure that they have the right level of English to join us. Now, that level of English varies depending on the age of the child. So very young children we can take with very little English. By the time they get to A-levels and sixth form, they have to be able to participate in the classroom straight away. Otherwise, they will just get left behind their classes. And then finally, if we do have a place, we'll be able to confirm and offer a place straight away. And then we'll give you all the information you need in terms of uniform and equipment and all things you need to know before you start school. We have a lovely web portal where that's all there, and you can make sure that you've got everything that your child needs to start school, whatever age they're coming to. If you don't have a place readily available, and we will start children all the way through the year. So if you have a child that's joined, if you're arriving in Malaysia in the middle of a term, we don't make them wait till September. If we have a place, they can start straight away as soon as you arrive. And if there's not a place available, then we would put them in the waiting pool and wait for a place to come up. It is worth saying we are a fairly small school, so we only have kind of a maximum of about 800 students in our primary campus and 800 students in our secondary campus. We're a 5-form entry, and once those 5 forms are full, we have to wait for a child to leave for a new child to come in. But we do have quite a lot of children coming and going because of the expat population. People come in, they do their contracts, move on to their next job or they decide to go home. So there are places that do become available, and usually a child doesn't wait too long for a place to come up. I'll leave you with Sic ad Astra, which is our school motto. In this way you shall reach the stars, and that's what we aim for all our students, for all the children that join us, is that they go on and have the best future that is the best fit for them in whatever career path they decide to follow.